Welcome to Food Revolution Conversations, where we explore healthy, ethical, and sustainable food for all. Welcome to this Food Revolution conversation. I'm Ocean Robbins, and I am so thrilled to be here with you right now to talk about one of the most important topics of our times, which is how we can bridge the health gap and the nutrition gap to support healthy, ethical, and sustainable food for all, with special attention on the communities that need support the most right now, that are struggling the most right now, that are suffering the most egregious consequences from a toxic food culture. And we're going to look today at what's possible, at hope, at visions, at how we can truly up-level the health and the well-being of all communities everywhere, and at practical examples of what works. And we're here today with the perfect person to be in this conversation with, Benjamin Perkins. He is a social justice practitioner, an intellectual, and a creative thinker, and he is the CEO of Wholesome Wave. Wholesome Wave is probably one of my favorite nonprofit organizations on the planet. They are creating partnership-based programs that enable underserved consumers to make healthier choices by increasing affordable access to healthy, locally and regionally grown foods. Ben has worked in the public health field for 2 decades, and since 2014, his focus has been on ending health disparities and inequities. He's worked for the American Heart Association as Vice President for Multicultural Health Initiative and Health Equity, and as Vice President of Health Strategies. And at Wholesome Wave, he is championing positive, practical, community-based solutions that can bring health and wellness where they're needed. So Ben, thank you so much for being here today, and thanks for your amazing work.
Thank you for having me. Thanks for that great introduction. I sound interesting.
Well, you are interesting, truly, and we're thrilled to be with you. You've talked about how food insecurity is about, and addressing food insecurity is about providing enough food to those in need, but nutrition insecurity and addressing it is about providing the right food to prevent or alleviate diet-related diseases. So tell us a little bit about what nutrition insecurity means to you and why you think it's so important in the world right now.
That's a great question. I think in terms of thinking about food insecurity and nutrition insecurity, I was talking to someone last night, and I was saying that one of the ways to think about food insecurity is sort of a subset, or nutrition insecurity is to think about it as a subset. If you had a little Venn diagram, nutrition insecurity would be inside of food insecurity, in that food insecurity is addressing the lack of food that folks might have, so issues of hunger. But nutrition insecurity, and this goes back to co-founder of Wholesome Wave, Michelle Nishan's sort of assertion that it's not just about getting people food, it's about getting people the right food and healthy food.
Yes.
And I think embedded in that is this concept of human dignity, that it is not just feeding people anything, but it's about getting at healthy foods where people can thrive, particularly folks who are on the margins, which is a large part of the populations that we pay especially close attention to.
Yeah. In the world right now, we have, perhaps for the first time in human history, more people who are obese than people who are starving, like wasting away from lack of calories. And yet some people are kind of both, and statistically, the poorer people are worldwide, the more likely they are to be obese, as well as to be starving outwardly.
Yes.
So we think of starvation as sort of an emaciation, and obviously that happens, and it's brutal and devastating, and it's, there's like 1 billion people on the planet almost who are in danger of that, who have fundamental core food insecurity on a daily basis. But there's also over 1 billion people on the planet who are obese. In the United States, it's now 40% of our population. Mexico is right up there with us. And there's an interesting and really painful corollary here, that people who are in poverty are more likely to starve, but they're also more likely to be obese because they're fundamentally fueling from maybe enough calories, maybe too many calories, but they're nutrient starved.
Yes. Yep. That difference between energy dense and nutrition dense. And it really sort of drives home exactly, that's the point you're making, this idea that foods that are energy dense often aren't nutrient dense. And there's that sort of chasm between those things potentially.
Yeah. The way I look at it, food 1.0 is about survival. If you can get enough calories to fill your belly, then that's success.
Yeah.
Food 2.0 is governed by commerce. It's the buying and selling and marketing of goods. And it's a step up for a lot of people to be able to have choice and authorship and some mobility around food. But unfortunately, it's morally bankrupt. And it's brought us nutritional and health disasters for many of the world's people. And that's why in Food Revolution Network, we're calling for what we call Food 3.0, which is a food system based around health for our bodies and health for our planet. And it seems like what you're doing is addressing how we can kind of leapfrog for people who are on the margins straight from 1.0 to 3.0, how we can move from get enough calories. Yes, of course. I mean, if all you can eat is a bag of potato chips and that's all you got, like for goodness sakes, eat the potato chips, you know?
Right.
But at the same time, what would happen if we focus on nutrient quality and nutrient density and how we create those opportunities for people? But a lot of folks struggle with the cost of healthy food. I mean, Whole Foods has the unfortunate nickname Whole Paycheck. And we see a lot of people who would just feel like we have to pay an arm and a leg just to do the right thing. It's almost like you're being fined for wearing your seatbelt. You know, you want to feed yourself and your family right, you got to pay, you know, extra. How are you guys trying to address that?
Another great question. How we're trying to address it is, and you had mentioned SNAP, for instance, and that concept of doubling up SNAP bucks, which is one of our claims to fame. We're one of our co-founders, the late, great Gus Schumacher, who was the Undersecretary of Agriculture during the Clinton administration. He was a big proponent of the idea of incentivizing SNAP so that you could get more for your dollar by buying healthy produce, healthy fruits and vegetables. Now, the idea there is still giving people choice, but incentivizing healthier choices so that folks might be more drawn to those healthier choices. Because exactly what you said, if the perception is that healthy foods cost more, and I only have a limited pool of resources, namely dollars, I'm going to gravitate towards the cheaper food, the more energy dense food and less nutrition dense food. And so that's one of the ways we think about it. Also, the notion of produce prescription. So working in health systems or with community partners who are really committed to healthier communities, in building in produce prescription programs so that a healthcare professional can write a script for that individual to go and purchase healthy fruits and vegetables.
Well, let's talk about each of these programs in more depth. So the Double Up Bucks program basically says for somebody who is on food stamps, who has food stamps, and there's about, what, 50 million Americans or something right now who are part of that?
Yeah, so I was doing a little research, and I think it was the number I heard or read was 45.8 million in the US right now. 14% of the population.
14% of the population, 45.8 million people, and a lot of them kids, are dependent on this program to eat right now. And you know, we could debate till the cows come home, you know, what's the right role of government? And I don't think any of us want to see a world in which people depend on SNAP dollars to feed their families. Everyone wants to be self-reliant and have the resources they need to provide for themselves. But that's not the world we live in right now.
That's
and
correct.
At this point in time, for all of the factors that are at play, racism and all the dynamics at play, we have a lot of people right now who are marginalized, who are on the edge. And this is a fundamental social safety net that we've created. Unfortunately, most SNAP dollars are not buying healthy foods. As we've discussed, they're buying the cheapest calories, and a lot of them are going to foods that are making people fat and sick and increasing their likelihood of getting diabetes and heart disease and cancer and Alzheimer's and feeling like crap and ADHD for the kids and making people have a harder time in school because they don't have the nutrients they need to thrive. So what you guys are doing is you've led this program where for every dollar they spend on fruits or vegetables, they're getting double bucks, right? That means
Yep.
they go twice as far. So instead of, paying $1 for X amount of broccoli, you now only pay 50 cents, which means you can get twice as much broccoli. So it creates this financial incentive to buy more fruits and vegetables specifically. Okay. So when that happens, do people buy more fruits and vegetables? And maybe more importantly, do they eat more fruits and vegetables? How many people are in the program? And what kind of results have we seen in terms of any possible health impact so far?
Yeah, so the research suggests that people, when presented with the opportunity, and I think this is something that's really important to highlight, regardless of which program we're talking about, when people have the opportunity to do healthier, to engage in healthier behaviors, namely eating healthier fruits and vegetables and foods in general, that they do. That's the bottom line. The other thing to know about SNAP in specific is, so you've got 45.8 million people on SNAP. One of the things that I learned about SNAP recently from Dr. Dari Mosafarian at Tufts University here in Boston, where I live, is that the research on SNAP beneficiaries, that SNAP beneficiaries are twice as likely to die of cardiovascular disease and 3 times more likely to die of diabetes complications. So you see there that there's a huge need in terms of that population to do whatever we can to incentivize healthier consumption of healthier fruits and vegetables.
Yes.
So things like looking at the drop in A1C, looking at drops in blood pressure, systolic, diastolic blood pressure, those sorts of things. All of those health outcomes tend to improve with nutrition incentive programs. And the thing is, right now, this is all proof of concept. Now, certainly, I would argue, and I think most people would argue, that it seems pretty intuitive that people would get healthier. But what we have to do is we have to make the case. So all that we're doing now is a gigantic proof of concept, marshaling all the data from all of the studies that we are a part of, all the work, and then using that data in the service of making the case so that ultimately these kinds of things can be embedded in federal and state policy in a long-term sustainable way.
Yes, absolutely. And there's about, what, 500,000 people that have participated in the Double Up Bucks program so far. Is that right?
I'm not sure of the exact number, but that does sound about right.
Okay, so we're not talking about a small scale. This is
Right.
getting sizable traction already, and it's in
Yes.
quite a few states, like what, 20 or more states, I believe, last I heard.
At least, yeah.
Okay, yeah, so it's widespread, it's geographically diverse, reaching a lot of different communities, 500,000 people involved. And is that all funded by private donors so far, or is the government pitched in?
There's a mix. So so Gus Schumacher, who I mentioned before, part of his legacy was that there was a farm bill in 2014. It was $100 million earmarked for these kinds of programs, and then he died in 2017. So in 2018, when that farm bill got reauthorized, it was renamed the Gus Schumacher Nutrition Incentive Program, or what we affectionately call GUSNIP. So at $250 million. That's not a lot of money, okay? And so part of the program really looks to public-private partnerships. So the government put some money in, but also we're looking for matching dollars. So whether it's corporations or foundations that are also interested in the health of communities and populations, they would bring dollars in. Private donors, we're open to partners in terms of matching the federal dollars.
Got it. Thank you. So I guess the worry would be that some might have, just the cynic would say, well, if people get double value for fruits and vegetables, they might buy more fruits and vegetables because it's sort of like it's on sale, so to speak.
Mm-hmm.
But will they actually eat them? Will they just rot in the fridge? Will they know what to do with them? And so do you have any thoughts about that? Have you brought in any sort of culturally appropriate recipes or cooking techniques or lifestyle habit and feedback for people?
Yeah, that's a great point. And yes, so part of it is that we also want to embed nutrition education programs. And so at Wholesome Wave, our program directors work closely with community partners and health systems to, first of all, assess what kinds of resources they have and to provide resources, whether that be something like a nutrition education component embedded in the programs. Because to your point, it's great that people have access to healthy fruits and vegetables, but if they don't know what to do with them, then of course we're talking about potentially food waste. The other piece of it that you alluded to that's critically important, and this is a part of the dignity component, is it's not just about getting people healthy food, it's about understanding the particular culture. Because if you can get healthy produce that's culturally specific, then the chances are greater that folks will know what to do with it in the first place.
Yeah, absolutely. Fabulous. Okay, well, let's look at another program you guys have been running. You people have been running the Produce Prescription Program. A lot of P's there.
Yes.
So the Produce Prescription Program, as I understand it, you're piloting this, and the concept is that at least for Medicare and Medicaid recipients, and perhaps ultimately all insurers could get in on this,
Yep.
that doctors can prescribe produce. Like
Yes.
go to the pharmacy with an F, not the pharmacy with a PH, right? And
Yep.
essentially get your produce. And it's interesting because now for somebody who has heart disease or diabetes, which are extremely diet responsive conditions, you can get results fast. I mean, arguably as quickly as with going on statin drugs, for example. You can bring down your LDL cholesterol levels. You can bring down your blood pressure rapidly with diet and lifestyle choices. This is proven in study after study. And unlike with drugs, the side effects are all positive. You're also bringing down your risk of dementia and cancer, and you're probably going to feel better and have a better sex life too. So we focus on this a lot in our work, and it seems fascinating to consider what could happen if doctors prescribed healthy food. I suspect, just like with the Double Up Bucks program, not everyone knows what to do with it or how to cook it, but people will undergo extremely unpleasant things because their doctor told them they needed to. I mean, I don't know anybody who does chemotherapy because it's pleasant, right? Or goes through massive surgery because it's fun. But they'll do it because their doctor said their life depends on it. So my thought is that if their doctor tells them they need to change their diet, sure, some people will struggle. But if they really know what's at stake, for those people who are in these conditions where it's life or death, a lot of people are willing to make choices, even if it's a little less fun, even if it requires some work or some new habits, because they get what's at stake. So obviously we need doctors who are informed about nutrition and motivated and who give it appropriate gravitas. But then we also need the resources so that they can not just say, hey, you need to eat better, good luck with that, and send somebody off on their own into the wild world of food insanity and a toxic food culture, but rather somebody who can specifically prescribe specific things. I want you eating broccoli. I want you eating whatever the things are every day, right? So is this specific to produce, or do you include any other foods? How widely has it been used so far? And what's the strategy here?
So the strategy, I'll start with the first question. The strategy is really as you detailed, which is the idea that someone who has a specific health condition, a chronic health condition, namely cardiovascular disease and diabetes, would be prescribed produce, so fruits and vegetables primarily, although there's now talk about the role of legumes, but that is it right now. Now that may evolve at some point, but for now, our focus is really on the healthy fruits and vegetables. So if you have a chronic health condition, or you are trending, and this is important, trending towards, so you're pre-diabetic, or you have a history of hypertension, or those sorts of things, and the doctor really identifies that you are at risk, the idea is that they would then give you the produce prescription in the form of it could be a credit card that you could use at a specific outlet, grocery market. It could be a gift card that can be used at a certain venue, or it could be our work with certain fulfillment vendors who will get you the produce. It can be delivered directly to your home. Now, this is really important as we think about the pandemic. This was one of the fulfillment options that we had in some of our locations, is that folks could actually get it delivered directly to their home, so that therefore they're not risking COVID exposure. But the idea is they're enrolled, they're able to get their healthy fruits and vegetables and monitored over 6 months to a year. We actually like it to be as long as possible, but 6 months to a year. Some of the programs have been shorter, but the idea is to give them the fruits and vegetables, the dosage at intervals, and then to look at the health outcomes. So things like their blood glucose, so A1C, their systolic, their blood pressure, systolic, diastolic blood pressure, their BMI, and see what the trends are over the duration of the prescription program. And that data is the data that we use to make the case for why this is impactful. And importantly, looking at things like the reduction of cost burden to the system. So improved health outcomes means that the burden in terms of healthcare costs gets decreased. Yes. We're also looking at patient experience, improving that. And that's all part of this notion of the triple aims of value-based care now, which is a huge part of a paradigm shift in healthcare overall.
So what does the data say so far? Do you have any results back yet?
So that's a great question. I was looking at some data. One of our programs in Ohio looked at, this is a produce prescription program, a 0.5 point drop, a half a point drop in A1C, which, if you know how A1C works, a half a point drop is quite significant. Yes. 22.3 point drop in systolic blood pressure, 14.2 point drop in diastolic blood pressure, and 4.9 point drop in body mass index, or BMI.
4.9% drop.
Points drop. Yeah.
Points drop. Okay, yeah. Got it. Yeah. All right. Wow. Thank you. And that's after what, 6 months, a year of
that was I'm not sure here. It doesn't tell me exactly how long that period was, but okay. Again, we usually look at, on the short end, about a 4-month program. On average, though, 6, and the gold standard is getting it as close to a year as possible, because what we know is the longer you have someone in these, the longer amount of time they have to build those habits and get that reinforcement that's essential to sustain long-term, health changes.
Yeah. So double up bucks and produce prescription programs, 2 brilliant strategies. Let's talk about implementation and scaling and what could happen. So what would it cost approximately, do you think, for the USDA to expand the Farm Bill to make double up bucks normal throughout the SNAP program in the United States for the 45 million or so people who use the SNAP program to feed their families?
That's a great question, and I'm the wrong person in terms of just sort of doing the policy wonky thing. But what I will say is that the question cuts right to the heart of the necessity for there to be both a public, so the government, the role of the government, certainly easily billions and billions, and we're talking about every year, but also in addition to the government, the role of the private sector could play a really critical role. And one of the things you alluded to is about insurers. So the idea that insurers could play a role, a key role in this, because guess what? If people are healthier, they're less likely to need to avail themselves of medical visits that the insurer has to pay for.
Right. Sure. There's a lot of incentives here. Employers have incentives too, by the way.
Yep.
A healthier workforce is going to save them, yes, insurance premiums in the long run, especially for those that are self-insured, but it's also going to give them better productivity. They'll have clearer minds on the job. Their employees will get more done. They'll have less sick days. They'll feel better. And all of that is good for company success as well. So employers have a stake in it. Public health initiatives have a stake. All of the insurers have a stake. The government social safety nets have a stake, because a healthier population is going to be wealthier. It's going to be more productive. It's going to be more capable and able to respond to challenges in life effectively. And of course, humanitarians and philanthropists have a stake here too. For anybody who's got a little extra, these are places that you can invest in that could make an incredible bang for the buck, way more than double up bucks in terms of its net impact on human quality of life. I want to talk about the produce prescription program for a moment, and a study that Tufts University did in 2019 on this. They looked at, what could happen if this was scaled on a large scale through the Medicare and Medicaid program. What is that? 25% of the US federal budget is Medicare and Medicaid. So we're talking about trillions and trillions of dollars that are being spent on healthcare for certain populations. And if we implemented produce prescription programs throughout the Medicare and Medicaid system for those people who are dealing with lifestyle responsive health ailments, what would happen? Well, the first co-author of the study ended up commenting that he said, we found that encouraging, this is a quote here, we found that encouraging people to eat healthy foods in Medicare and Medicaid, healthy food prescriptions, could be as or more cost effective as other common interventions, such as preventative drug treatments for hypertension or high cholesterol. Giving out the big numbers, they found that if they were to implement a program where people not just got prescribed fruits and vegetables, but also legumes and nuts and seeds, and they also added in their seafood and plant-based oils, because these are all things that have been found in studies to be beneficial for health. And if they provided 30% coverage for those things, essentially, through the produce prescription program, the total cost would come in at, we're talking about a couple $100 billion over the course of a long period of time. We're also talking about savings of $100 billion in immediate healthcare utilization within a 5-year period. But we're also talking about long-term savings that go far beyond that. The conventional cutoff point for a medical intervention to be considered cost-effective is if it's less than $150,000 per quality of life year gained. If costs are less than $50,000 per quality of life year gained, those are considered highly cost-effective and medical best buys. Well, here we wound up with looking at around $13,000 in net intervention cost per quality of life year gained. And obviously half of that comes back through reduced medical savings within a 5-year period. And obviously there's so many other benefits to it from a humanitarian perspective, public health, economic productivity, etc., not to mention just caring about people's lives and wanting them to live well. So the bottom line here is this stuff works. We can study it more. We can figure out how to fine tune it. But you're onto something that could transform the lives of so many human beings. And just to put out the big numbers, these could, the produce prescription program they found could, in a 5-year period, could prevent 120,000 cases of diabetes. It could prevent 3.28 million cases of cardiovascular disease. And again, it will be as or more cost effective than a lot of currently covered medical treatments. Ben, when you hear about these numbers, what goes through your mind?
It's like, let's do it.
Okay.
You marshaled all of this data. And as I was saying, a lot of our work is around marshaling more data through these programs, but there is tremendously compelling evidence already. And one of the things I think you alluded to, which a lot of us are aware of, is in the United States, our health system is really disease management and not health promotion. And so when you ask yourself, like, where are the incentives to doing stuff like produce prescription? If there's more money in medication and those sorts of things, it really sort of leads you to some uncomfortable kinds of conclusions about how our system is configured in the US.
Well, I mean, the bottom line is nobody's getting rich from prescribing broccoli right now. I've often thought if reimbursements were the same for prescribing broccoli as prescribing chemo drugs, we'd see more broccoli prescribed and we'd probably see less chemo drugs prescribed. The reality is that food is medicine and it's nutrition and it prevents the need for other medicines. But unfortunately, we have a healthcare system that acts as if food didn't matter. And of course, we have a food system that acts as if health didn't matter. And at the end of the day, in this context, it's up to each of us to take as much personal responsibility as we can in a toxic food culture to not be a victim of the status quo, which is a fast-track disease and suffering and premature death. But a lot of folks in this system do not have the means, the resources, the time, or the money to be able to exercise that kind of self-authorship. Because when you're working 2 jobs and you're barely able to pay rent and you're super stressed out, it's really hard to learn a whole new way of cooking and feeding your family, and it can be hard to afford it. So Absolutely. What you all are doing is hitting the nail on the head of how to address that issue. I know of no other organization in the world that is addressing so directly this core problem we face right now, so pragmatically and so effectively, with solutions that really could change the entire game. So Ben, what's your vision? What's next? How do we make this happen? And how can folks help you?
So the vision for me, as someone who stepped into this role of leading this organization, is really to help us live out our core values. And so one of the things that I have sort of coined is this concept called the FED principle, which coincidentally, as an organization that does work in nutrition security, is kind of fun to play with. But FED stands for fidelity to communities, equity, removing barriers and improving access, dignity, the acknowledgement that human beings have an inherent worth and therefore are entitled to healthy nutritious food as a human right. So that FED principle is our North Star. And so everything that we do in terms of how we think about our work needs to measure up to that. That is the measure by which I am gauging our success. And ultimately, the vision is that we can get things like produce prescription embedded in federal and state policy, because what we know is that policy lever plays such a vital role in the health and well-being of not just communities, but entire populations, because we know that ultimately there's a deeply structural element to this. And one of the ways you get at structural issues is through policy levers. So that is key to how I see us in the future moving forward.
Yeah. I'm just reflecting on how chronic illness is a leading cause of bankruptcy in the United States. there's a direct connection between illness and poverty, generational poverty. When someone dies penniless, they leave nothing to their children. And so cycles of poverty continue across generations. And I think it's not too bold an assertion to suggest that if programs like what you're talking about were implemented, let's say let's just talk about double up bucks for a second. If that was implemented, on a broad scale, I think that within a generation, we would have less people dependent on the SNAP program because we'd have less grinding poverty because we'd have a healthier population. And by focusing on those communities that are the most impacted by chronic disease and that are struggling the most and giving them a leg up on their health outcomes, we can change the whole game, and we can build a fairer, more equitable society that empowers people and families to save instead of depleting their resources on medical expenses they can't afford. And we can turn it all around. So I think it gives me a lot of hope. I'm so grateful to you. And of course, it goes without saying, but this is a nonprofit organization, Wholesome Wave, and it should be said. Anybody who can contribute as a participant, as an advocate, spread the word, share this video, share their website, and if you can, donate money. Not just, people can donate, right, to support literally funding double up bucks programs or prescription programs, but they can also support the organization that's seeking to leverage tens and ultimately hundreds of billions of dollars in public funds to make these things happen, right? And that's Wholesome Wave's big picture mission. We're never going to get all the way there just with private donations. We can pilot stuff with private donations, but the goal here is much, much bigger. And so investing in this organization really is leveraged in a huge way. And if we can establish the data that shows that this stuff works, and I think it's inevitable that data is going to come out more and more, then it's just a question of getting folks in power to act on that data. And I think we can get something done here. So Ben, thank you, bless you. It's been wonderful to share this time with you, and I look forward to doing a lot more together in the future. And by the way, everyone, Food Revolution Network is major donors to Wholesome Wave. My dad and I and our whole company are on board. We'll continue to do so, and we invite all of our members to do so as well. Ben, thanks so much.
Thank you.